Hi, I'm Dr. Obermeyer, and the purpose of this video is to review the decision to have surgery at an ambulatory surgery center. An ambulatory surgery center is an outpatient surgical facility where typically a specialty or a series of specialties offer outpatient care where surgery is completed and the patient leaves the facility the same day. This is in contrast to a hospital, which offers multiple layers of different types of services, including emergency department, intensive care, and other types of services. The practice of orthopedic surgery, and specifically orthopedic sports medicine, has evolved over the last decade or so to facilitate improvements in the care delivery model, including anesthesia technique, where things like blocks, spinal anesthetics, and different types of procedures to improve the patient's postoperative experience are becoming the norm. Additionally, there are improvements in the way that the surgery itself is executed, with increasingly minimally invasive techniques that facilitate the patient's recovery, their pain management, and ability to return to athletics, and also the way that robotics have been introduced into the orthopedic realm. Concerns about hospital-acquired infections, which were manifest during the coronavirus pandemic, allowed the acceleration of procedures to shift to the outpatient ambulatory surgery center setting. Procedures such as spine fusion or knee replacement or shoulder replacement, which had historically been performed only in the inpatient setting, were done increasingly safely and efficaciously in an outpatient ambulatory surgery center setting. It was during this shift that we realized the improvements in the patient satisfaction, their outcomes, and the safety profile for performing increasingly advanced orthopedic procedures in an ASC setting. And therefore, many of these procedures have become the norm to be performed at an ambulatory surgery center setting. Additionally, a specialty-specific orthopedic ambulatory surgery center really only offers one service line, which is the performance of orthopedic procedures, which allows streamlined protocols and techniques to facilitate and improve the quality of care for orthopedic patients. The literature is replete with evidence that patients are more satisfied with the quality of their care as well as with their outcomes when their procedures are performed in an ambulatory surgery center setting. The care is efficient, specific to their individual problem, as well as has a staff that is very frequently adept at managing orthopedic problems. As we move into the mid-2020s, increasingly insurance companies are aware that many of these procedures can be performed safely in the outpatient ambulatory surgery center setting, and as a result, many payers, including Medicare, are allowing these procedures to be performed routinely in an ambulatory surgery center setting. Among the advantages of having surgery at an ambulatory surgery center is not only the quality of care, but also the cost and the efficiency realized as cost savings to the patient. Research indicates that common procedures, such as joint replacements, can be performed at an ambulatory surgery center with a savings to the patient between 17 and 43% on average, with specific studies showing things like rotator cuff repair having a 40% cost savings to patients, and other common procedures such as knee arthroscopy or joint replacement having as much as a 50% reduction in cost to the patient compared with the hospital outpatient department. The rates of savings when comparing different procedures at an ambulatory surgery center versus those at a hospital can be performed by looking at the hospital outpatient department, specifically HOPD, which is a designation for surgery that is an outpatient where the patient leaves the hospital the day of the procedure. This allows an apples-to-apples comparison with the cost of different procedures at an ambulatory surgery center setting versus those at the hospital. And one will realize there are significant savings to be had by the patient when their surgery is performed at an ambulatory surgery center. Efficiency of care delivery for patients having surgery at an ambulatory surgery center is another factor that drives satisfaction rates. Specifically, patients are discharged from an ambulatory surgery center in a much more efficient and safe manner versus at the hospital, where outpatient surgery stays are sometimes as much as 24 hours, with things like administrative delays and other burdens complicating the patient's discharge. Safety and infection risks are also critical factors that are increasingly pushing patients toward the ambulatory surgery center setting, where things like infections that are deep after a joint replacement are significantly lower in the ambulatory surgery center setting. The ASC's specialty focus, strict infection prevention guidelines following the CDC, as well as The avoidance of the hospital environment, which is known to harbor different types of infections, is one of the reasons that things like deep infection after joint replacement is significantly lower in those procedures that are performed at an ambulatory surgery center. When deciding on whether to have surgery in an ambulatory surgery center or a hospital, it is also important to compare the outcomes or the specific results of the procedures that are performed at the different settings. We do know that multiple studies suggest that the outcomes, and even in my own hands, are better when surgeries are performed in an ambulatory surgery center setting for things like rotator cuff repair, total shoulder replacement, knee arthroscopy, anterior cruciate ligament reconstruction, other types of knee procedures, including knee replacement. Recovery following surgery at one's home, which comes with some of the conveniences and comforts of having one's own food, sleeping in their own bed, and having their loved ones at their side, as well as avoiding some of the different noises and distractions that are evident in a hospital setting, make satisfaction rates consistently much higher when patients have surgery at an ambulatory surgery center setting. In the United States, the Center for Medicare and Medicaid Services, or CMS, continues to expand access to some of the historically more invasive procedures to be performed at ambulatory surgery center settings. The improved regulatory support and the increasing interest among patients, surgeons, and different insurance companies and payers continues to facilitate the shift of many of these procedures to the ASC setting. For many patients, skipping the hospital can mean not only cost savings, but also additional improvements in the outcome and the safety profile of the procedure, as well as many additional benefits in terms of patient satisfaction. Thank you for your interest in this decision to have surgery in an ambulatory surgery center, and please visit our website for more information.